Crohn's disease patients suffer chronically from physical symptoms and psychological distress and have poor disease coping strategies. In our previous articles, we have reported that cognitive behavioral and mindfulness intervention, which is also known as CBMI, improves mental health in patients with mild and moderate disease severity and increases their quality of life. CBMI is a psychosocial intervention that teaches patients a mixture of cognitive, behavioral, and mindfulness stress reduction techniques such as deep and aware breathing, body relaxation, understanding the way we interpret situations and challenge our biased thoughts, and different meditations that direct and focus our attention. The intervention is composed of 8 sessions conducted by Skype or Zoom. The sessions are one-on-one with a social worker. And big emphasis is being put on home exercise. The patient is required to exercise 10 minutes twice a day and self-report it. In the current study, we had 2 targets. The first, to determine if at least once a day 10 minutes exercise of CBMI techniques boosts the symptomatic and psychological betterment. And the second, to evaluate the benefit on patients' disease coping strategies. We used several tools to collect our data. In order to clinically assess disease activity, we used the Harvey-Bradshaw Index questionnaire known as the HBI scale. The higher the score, the higher the disease activity. Physical and mental health was assessed using the SF-12 questionnaire, in which higher score indicates better health. The FACIT fatigue questionnaire was used to assess fatigue. In this scale, higher score indicates higher fatigue. Distress was assessed using the brief symptom inventory, which is composed of 9 scales like depression, anxiety, and somatization, and so on. Higher score in these scales indicated higher distress. And coping resources were assessed using the brief cope questionnaire, which is composed of 3 coping strategies: emotional focused coping, problem focused coping, and dysfunctional coping. Perceived social support was also assessed as one of the resources a person has. We used the multi-dimensional scale of perceived social support. Higher scores of coping means using more of the resources indicated. And lastly, to assess exercise levels, we have built a self-report smartphone application. By clicking on a personal link received by their smartphone, patients reported about their exercise sessions. They reported if they had exercised in the morning and or in the evening, and which stress reduction techniques did they use. 100% of exercise equals twice a day reports on all days. So here are the results of our study. As you can see, we had a cohort of 99 Crohn's disease patients. 65% of them were women. The mean age of patients was 34, with a mean disease duration of more than 9 years. Most of the patients did not smoke, had a higher education, and were working. The median disease activity of the cohort was 8, meaning moderate disease. These are the exercise rates of the patients. As you can see, 67% of the patients have exercised twice a day during the 3 months, half of the time, and 75% of the patients exercised once a day, half of the time during that same period. Here we can see the significant correlations between the exercise rate of the patients and the parameters we have checked, while taking into consideration the level of Crohn's disease at baseline. We can see that for Crohn's disease patients who suffered from mild HBI, the orange line, the more the patient exercised, the better they felt physically. They felt less fatigue, and some of their distress parameters like depression, anxiety, and somatization were decreased. The more the patients exercised, the more they used the 2 more effective coping mechanisms, emotion and problem focused, and the more they perceived their environment as supportive. We can also see in the red line that patients who started the intervention with a moderate level of disease, the more they exercised, the less fatigue, anxiety, and somatization they felt, and used more emotion-focused strategies to deal with their condition compared to patients who exercised less. Our conclusions are that exercising CBMI daily for at least 10 minutes was associated with better physical health, lessened anxiety, depression, and somatic symptoms, and more efficient coping strategies. The response was better in patients with mild disease. These findings indicate the important role of daily exercise. and the data support the integration of CBMI practice daily into the life of Crohn's disease patients. Thank you for your attention.